Hello, welcome back to the CIRS Summit, a patient-centered event. I'm Jenny Johnson with the Simplified Wellness Designs and the CIRS Healing Collective, and I'm here today with Dr. Anjali Noble of the Noble Center for Health and Healing in Boca Raton, Florida. Dr. Noble is going to be talking with us about CIRS and hormones. This is a huge topic. Strap in. We are going to be going for a ride. She has so much valuable information to share with us. She's going to be doing a PowerPoint presentation, and we're going to have a fun little discussion at the end. So hang on for the Q&A and discussion at the end. But Dr. Noble, I know that you're an integrative and functional medicine doctor. You are Shoemaker certified, but I'd love for you to share with our audience maybe a little bit more about your training and your background, just so we can fully appreciate all that you're bringing to the table today.
Thank you, Jenny. Thank you for asking me to, speak on hormone balance in the setting of chronic inflammatory response, because it is just such an important topic. And I think that it's very misunderstood and people are, misdiagnosed and treated. And I'd like to bring clarity to that. So I do feel honored and grateful that you've asked me to speak at the summit. I have been treating men and women with bioidentical hormones for over 20 years. I am very involved with the American Academy of Anti-Aging, Regenerative, and Functional Medicine. I am one of their oral board examiners and part of their faculty, and one of the first certified through them back in 2000, early 2000. And I am very passionate about hormones because I had hormonal dysfunction myself and nobody could help me. And that's how I delved into this. My original background is being board certified in internal medicine. And what I learned is that it was still failing people and getting them well. And we
Yeah.
were missing the root cause of everything. So what you will, hear me talk about today is really talking about how intricate the subject is. And, we do have a lot of these rejuvenation and regenerative centers and stuff like that that are, treating people, but they're really not looking at the whole picture. And understanding it in the setting of a chronic inflammation is really, really important. So
Right.
I am honored to be here today, and hopefully I can bring clarity to the table.
Wonderful. Thank you so much, Dr. Noble. Well, I know that you have a great PowerPoint for us. So you are welcome to share your screen and take us through your content. I'm really looking forward to this.
All right, so hormone balance in the setting of chronic inflammatory response syndrome, like I said, is it super, super important to understand, um, you know, hormones and what a hormone is, right? So these are the things I'm going to be going through, is what a hormone is and how it affects the imbalance of our system, especially with inflammation, and how biotoxins and toxins disrupt the whole hormone balance, and how is the best way to treat patients and know what's going on with you and how to treat it properly in this setting. So I think we have to start with just some basic understanding of what a hormone is. And basically, hormones are signaling molecules that affect receptor sites, and they, regulate physiology and behavior. There's all different types of hormones. So today I'm going to be talking more about the steroid hormones and the sex hormones, which, as you can see here, they include estrogen, testosterone, progesterone, and the stress hormone cortisol also has to be looked at, because we can't live without cortisol. It's our, fight or flight response. It basically will tell us if, somebody's coming, to rob us. It produces us to go and run. But when that is unchecked, we will get a complete imbalance of all of these hormones.
Mm.
So what's important with hormones is it's regulated by a feedback system in the brain. So when the brain sees a lot of hormone, it will shut down its processing of hormones. So that's really important to understand. And if it doesn't see enough hormone, it's going to start, telling the body and stimulating the body through stimulating and releasing hormones from the brain down to the sex organs, which I know that are, the testes and the ovaries. And what's really important is understanding that the receptors are very important, because when you're dealing with hormones, there has to be binding to receptors first. And sometimes those receptors will get plugged up and cause, imbalances of the system, which will create different symptoms and uneasy feeling in all of us.
Mm.
So when it's in balance, there are really positive effects of our sex hormones. So estrogen, when it's balanced, it can protect us from osteoporosis and bone loss, memory issues, heart disease, losing our urine. We call it incontinence from either coughing or working out. And, this happens as we age. If you have a balance of estrogen, you can sleep better, all of your senses are better, everything is better, including the skin. And I'm sure everybody knows that we're in menopause. We get these vasomotor symptoms like hot flashes and night sweats and all of this, crazy stuff. And our mood is depressed and we're tired and we feel blah, pretty much.
Yeah.
Also, when we have a good estrogen balance, we can handle pain and we're more resilient to pain and things like that. So when progesterone is in balance, it balances out estrogen. It actually increases calming, also helps with the mood, balances our sleep and fluid. It protects our breast from fibrocystic breast and breast cancer. So sometimes people feel like if they're treating with, hormones that, you're going to get cancer. Well, progesterone is one of those ones that will really protect you from those problems and protect your uterus from an uninhibited estrogen affecting the lining of the uterus. So there's just so many benefits. The biggest studies when it comes to hormones and progesterone and estrogen are, heart, brain, and bone. So testosterone, the same thing. It helps us build bone. Men and women both need it, different levels, but we all need estrogen. We all need testosterone. It's not just, just men only need testosterone, women only need estrogen. We actually do need testosterone, and it will help, especially with men when it comes to metabolic issues. And more data is illustrating that help. And, again, it's the brain, mood, all of those things. So having testosterone is really, really important for our health and making us feel good. DHEA is super, super important when it comes to chronic inflammation, and I'm going to keep going back to the DHEA. It is a androgen, and it is one of the precursors to all the other hormones. And I'm going to try to start because it's really important that people understand the process of things. And then when you go to your doctor and you start asking them about hormones, you'll kind of be educated, because there's just so much misdiagnosis and misinformation going around. You got TikTok and all these things giving crazy advice, and we don't always want to follow it. So I love DHEA because it protects us against the effects of stress. It also helps us with inflammation, helps our immune system, our brain, and it really, really helps with autoimmunity when it is in balance, and we don't have a depletion from multiple reasons that I'm going to go through with you. And believe me, all of these hormones also, prevent aging of the skin and the brain and all of those things. So cortisol is super important. It's the one hormone that we actually can't live without. So when it's in balance, it does great things. We need it. We need that fight or flight response. I mean, we want to run when a lion is attacking us. We don't want to just sit there, and it's the cortisol that really helps us do that, right? And
Right.
so I'm sure it was a big buzzword about 10, 15 years ago, adrenal fatigue and all this stuff, but we've learned a lot more about cortisol. Yes, it is, released from the adrenals, but it's also controlled from the brain, and it also will affect the brain when it's in balance. But when it's in a good balance, it will help us with the inflammatory response, help with this cortisol and all of the things that, I was just mentioning. Now look at this. These are all the things that can happen when the hormones are out of balance. And there's so many things that can make our hormones out of balance. It's not just one thing. So what I really want people to understand is we have to look at the true root cause. It's not just menopause sometimes. It's not just aging. There are women that are in menopause that actually have estrogen. And we're going to talk about where that estrogen
Mhm.
comes from and why they have excess estrogen and talk a lot about that. So everybody's understanding, the risk and benefit of replacement and where to look. But look at all these things that you see here, headaches, depression, vertigo, memory issues, stomach issues. We've got the night sweats and, all of these things and the brain fog that we all know so much about.
Yeah, they sound a lot like what we know of as CIRS symptoms, right? Lots of
Exactly.
crossover there.
Exactly.
Yeah.
So going back to biotoxin illness and chronic inflammatory response, I have highlighted, these symptoms that make the diagnosis of chronic inflammatory response. There's usually 13 groups and there's about 37 or so symptoms. And the highlighted ones, I mean, look at this, like these are all the same symptoms from hormone imbalance.
Yeah.
So, the fatigue, the aches, the headaches, the memory fog, concentration and joint pains, these are all very, very similar. And on the same
Yeah.
note, the things that are not highlighted are also important because those are the things that are pointing us to, wait a minute, this isn't chronic inflammatory. This isn't hormone imbalance. This is chronic inflammation. You don't really get severe cramping. You don't get blurry, like, blurry vision and visual contrast changes and things like that with hormone
Yeah.
imbalance. So knowing and differentiating which ones are which is really important.
Yeah.
Really, really important. So again, unusual pains. Everything highlighted here is crossover. They're crossover symptoms. But we're not
Yeah.
going to get, true sinus congestion, and you're not going to get tremors with hormone imbalance unless your thyroid's like really off. But in general, if it's a sex hormone issue, you won't. But look, you get body temperature regulation issues because that comes from a part of the brain called the hypothalamus, which is the regulatory center for these things. We actually now have a drug that they're using for menopausal symptoms that has been FDA approved that actually works on this center, and we call it the hypothalamus, which is the part of the brain that actually is also affected with chronic inflammation and chronic inflammatory response syndrome. But now we have a drug for patients who can't or aren't candidates for hormone replacement. So that's really nice that we're, progressing
Wow.
how it's become really important to the medical world.
Yeah, absolutely.
Yes. So night sweats, mood swings. So you can see here are 13, sections and all of these symptoms that are crossover. So I know this looks busy and I'm going to go back to this several times and kind of like break it up. But this is super important. And I love schematics and I give this to all my patients. So this is not something just for doctors to understand because I want my patients to understand why I'm giving them a certain supplement, why I'm saying what I'm saying, and what is the importance of each hormone or prohormone. So basically, it is a steroidogenic pathway. This is the pathway of the steroid hormones. And I'm going to go through each little section here, but you can see that it starts with cholesterol. If you look up into the left of your screen, hormones start with cholesterol. So if you are, pushing your cholesterol, like a lot of these cardiologists sometimes do, because they want to prevent a cardiovascular event, they're pushing cholesterol so low these days. And then we're not going to be able to make
Hmm.
hormones,
Hmm.
right? So that's a really important point to understand, to not push I've had patients that had LDLs of 30, and I don't necessarily think that that's good for their hormone health.
Right. Right.
Right.
Great point.
Yeah. So what's really important is in that little purple area, which I'm going to show you, is the metabolization of estrogens. All right. All estrogens are not the same, and that's really important to know. We have three types of estrogen. We've got estriol, which is the weakest of the estrogens, and it is usually produced during pregnancy. And there's two receptors on estrogen, And this was done by a Dr. Hortoff that did a lot of work and explained and did a lot of papers on these alpha and beta receptors for estrogen. And this is really important because so many people come and they say, oh, I'm going to get cancer. And so-and-so said, I'm going to get cancer if I, start bioidenticals and, I can't do that. And, so understanding the receptor sites is really important. So estriol is a beta receptor. It attaches to the beta receptor, which protects us. It's good. Even some European countries are using it to treat cancer, right?
Wow.
Yeah. Yeah, right. So it's not a scary thing. And it can be used in anybody. Estradiol is the main estrogen that we're all used to, understanding, and is the predominant estrogen when our ovaries are working. And that is a 50-50 alpha beta. Okay, so it could be carcinogenic if not processed properly, but in general, it's really healthy for you when it's in balance with the progesterone and all the things that I was, talking to you prior about. Then there's estrone. Estrone. Okay, so estrone is it binds to the alpha receptor. So it can be bad if it's not processed properly. And here's where, we can run into trouble. It is the predominant estrogen produced in the adrenal glands after our ovaries start to fail through menopause. You know,
Okay.
right? And perimenopause can last up to 10 years.
Okay.
And so, the definition of menopause is actually, 1 year without your period. But, the adrenals do start taking over and producing a little bit of this estrone when the feedback system doesn't see it. And it also is produced from aromatization of aromatization of other hormones, right? Especially testosterone. And
Okay.
in fat cells. So the more fat cells you have, the more estrone you have, and the more, everything turns into estrogen. And we do know that in chronic inflammatory response, we do get an excess of fat cells. And we'll talk more about that as I continue on. So this was going back to that steroidogenic pathway and looking at those three estrogens. You can see it in the purple box, and I highlighted it here for you. So what's really important in this slide and understanding is you have this estrone that I said can be very carcinogenic if not processed properly. So everybody has different genetic potential, of processing. We do have some genetic malformations, and these can be improved with certain nutrients and stuff that I'll talk to you about. But we want to push the estrone to a 2-OH or 2-hydroxy. Okay, that's that first little arrow that you can see under the estrone, which is in the left corner there. And you don't want to push it towards the 4-hydroxy or the 16-hydroxy. So if you look at that left side of that box, this is what we're looking at. And then if you look at the 2-hydroxy and all the way at the bottom, there's something called a COMT enzyme, right? I'm sure so many people, because we have, really health savvy people, and I think the people on this summit are those people.
That's true.
Yes. And yeah. So we want to methylate, right? So we
Right.
don't want to get that COMT enzyme working also. So the ways to be healthy with estrogen metabolism, whether you're replacing or not, is to push things towards the 2-hydroxy and methylate. And we're going to talk more about that and why estrogens are so important in this process and why I've spent so much time on this.
Awesome.
So I blew it up for you one more time because it's just so
Woo.
important. But you can see here that things can really affect the processing of the estrone down a wrong pathway. Pesticides and toxins and all of these things are going to push you, mercury toxicity, oxidative stress, all of these things are going to affect these pathways. So that's why it's so important to really understand and individualize what's going on with you before you go embark in replacing something in your body that you don't really know how your system's working. Okay. So I love this whole slide here. That's why I put
This
with
is
that.
fun.
Yes, I know, right?
Yeah.
Yeah, it tells a lot. That's why I love
So
schematics.
So the plus symbol, these are things that perpetuate or add to that pathway or support that pathway. And if it has a minus, these are things that would not support that pathway.
Correct. So you
Okay.
want plus sign with that 1A.
Yep.
You want that enzyme to push it towards the 2-hydroxy. So you want the plus sign, but you don't want
Yep.
to be full of sugar and then it's pushing it somewhere else. So
Yeah.
that insulin issue is another issue, right? And sugar issues. So why is sugar important? Like sugar is very important in being able to process our estrogens properly, right? Alcohol, you're going to see too, is going to plug up the system. So I'm going to go through more. I'm going to talk so much about this, but
Okay, great.
yeah, you don't want to support the 3A4 pathway, and push it there or push it to the, 1B1 pathway with the, polycyclic aromatic hydrocarbons and all of that stuff, right?
Got
Um,
it.
so we are going to talk a lot about more about this too. All right, so back to the toxins, right? What are toxins doing? This is why they're called endocrine disruptors. When you look at that pathway, that's why we have endocrine disruptors. And I'm sure these, you guys have heard about that. So we have bisphenol A that's in our plastics and lining in our cans and things like that. The dioxins that are really in non-organic in fatty meats and things like that. They can be, really toxic to this whole balance. Phthalates in the perfumes and fragrances and pesticides and hormones and parabens and all our creams. Like they're just really plugging up this hormonal balance to an unhealthy pathway, right? So it's really important that being able to detoxify these things is extremely important, as well as making sure you don't have an overload of them, right?
Right.
So detoxification in the environment of hormone balance is super, super important. What is your detoxification systems doing? It's very important to know. So I like to talk a little bit about detoxification when we're talking about hormones because it's so vital. It all occurs in the liver and then in the gut. You have 3 phases of detoxification. You have phase 1. You get, that all happens in the liver with all these P450 enzymes that I just showed you that are pushing things in all these directions. And then you get an intermediate metabolite. That intermediate metabolite can be more toxic than the original substance if
Mm,
it doesn't go through phase 2. Phase 2 is really dependent on conjugation mechanisms that make estrogen and toxins water soluble so they can be eliminated out of the system from the stool, from the urine, and from our sweat. But you can see that the gut is so important in this process. And I'm going to give you a nice little schematic of the liver and another, to better understand what I'm talking about and how important your nutrients are. So here we are, another layer of how this all matters. Nutrients matter, how our gut metabolizes nutrients, what is our nutritional balance and things like that. So that's what I really want to, point out
mhm.
here. How important it is. And you can see that phase 2 is that methylation process. And a lot of hormones have to be methylated to, be processed in a healthy manner. So we're going to go on how you can decrease the toxins into the system. And right there, you're helping yourself, right?
Right. That might be the easiest thing, right? Is
That's
just
the
take in
easiest
less
thing, right?
toxins.
Yes.
Yeah.
Yeah, because it's all the load on your system, right?
Yeah.
So you got, regular toxic, thing in chemicals coming into your system. And then you've got a biotoxin issue and you've got all of these things. So the body eventually is gonna like, go, whoa, 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 what's going on here? And
Yeah.
everything, the whole thing disrupts. But you can see how it's a whole process. It's not just one thing that is causing a hormone imbalance, right? So
Right.
this is the 2024. So it's all up to date, Dirty Dozen. So
Hmm.
these are the things that, I know that buying organic can be more expensive, but this isn't a lot. This is like, 12 things here or something. We can do this. Like we can buy these things organic. And right there, we've decreased our toxic load and decreased the pressure on our liver to be able to process all that. right? I don't know why this is like, so this is biotoxins. So let's talk about biotoxins. The two most common causes of biotoxin illness we know is mold and then tick-borne illnesses and Lyme disease and all of that, right?
Oh, trigger warning, right?
Yeah, I know we're all probably like triggered now, right? Everybody's like, no,
Oh.
no. And unfortunately, I got into biotoxin illness because I got it. And 10 years or 20 years ago, whatever, when I was, studying hormones, I didn't realize how important it was either. I didn't realize how a biotoxin illness is really affecting the hormone balance just right there, you know? And there was a lot I didn't understand. And thankfully, due to Dr. Shoemaker's work, I do understand it a little bit better. Not as well as he does, but I get it.
None of us understand it as well as he
I
does.
know.
We honor his
So
work and we try.
this is his work.
Yeah.
This is on survivingmold.com, and it is all here to really understand it. I love my schematics because, like I said, everything can be understood with one simple schematic that he did, that he made for us. So this is on his Surviving Mold website, and you really can see, the whole process. And we're going to focus for this talk. We're going to focus on the cortisols and the androgens and the steroid hormones that are here at the bottom of the page.
Mm-hmm.
So what
Love
we
it.
end up getting is when we have all of these cytokines and things like that, that because we have a genetic predisposition for this problem and the chronic exposure to mold and biotoxin illness creates this immune system upregulation with no shut off. You can see that we get something called leptin resistance, right? Leptin is also a hormone, and it is it affects our energy balance and it affects our hunger. And it creates, if we get a resistance to it, we do get more fat and more adipocytes. When that happens, and we also get a reduced melanocyte stimulating hormone, that is one of the, markers of this being this not just hormone imbalance, this is actually biotoxin illness, right? Because
Mhm.
a reduced MSH doesn't occur in just hormone imbalance, right? We have to
Got
have
it.
a
Yeah.
chronic inflammatory state to get that.
Yep.
Get a disruption of the cortisols, and the pituitary gland has this feedback mechanism where it stops producing the sex hormones. So that feedback mechanism is also really important. So the sex hormones start declining just in general, and then our cortisols, which I'll talk more about, end up declining. But I'm going to start with the androgen issue that we get with chronic biotoxin illness.
Okay.
So here are the androgens. I spoke to you about DHEA, and it goes into and can metabolize into testosterone on its own. In a male and female, we can get conversion of that to dihydrotestosterone, which causes aggressiveness, acne, hair loss, all of those things, which we don't want, right? But what's important here is we have an enzyme called aromatase. Remember I said that when we have more fat cells, we aromatize the estrone and estradiol and all of those things.
Mm-hmm.
We get more of that because of this aromatization. And the testosterone, if you throw testosterone at a male, they're going to become really estrogenic. Even in a female, if you throw testosterone at her. On a side note, testosterone is actually approved for women. Unfortunately, right now it's FDA approved for sexual dysfunction and things like that, whereas in men, it's approved for everything for them. But, there are other reasons to replace testosterone. But when you're dealing with biotoxin illness, you have to be very, very careful, right? And that's because of this aromatase enzyme. Another way, you can look at the green box here. And, I love my schematics. There's your aromatase enzymes. And really focus on those enzymes. And I'm going to show you one more step of the things that affect the aromatization. I love
Mm,
my schematics. You see
yeah.
how one slide I can show you, right?
Yeah.
So you can see that, again, excess adipose from the leptin resistance, inflammation, chronic inflammation, the sugar issues, all of these things, stress. I mean, look at how it
Mhm.
upregulates that aromatase enzyme, right?
Oh,
deficiency. So all of these things are so important. And what's of special note is the things that block the aromatase too. If you want to go back and look at that, green tea, resveratrol, chrysin, and I'm going to talk a little bit more about that. So maybe we can do things that can help this process.
right, right.
Okay.
So am I seeing that vitamin D3 increases aromatase
It
activity?
can, it
Okay,
can,
interesting.
it can, but if it's in balance, no, you're
Right. It's
fine.
all about the right balance. Yep. Too much
It's
of a
all
good
about the
thing.
right balance. So you don't want to
Yeah.
become detoxic. The next thing you know, you're aromatizing everything. Alcohol is a really big one. So estrogen
Mhm.
dominance is a thing in both men and women. It happens, right? So, just like women, men can get the breast tenderness, the nipple issues, things like that, the labile mood, PMSE, everyone, belly fat, all of these things, decreased libido, all that, right? They're not going to get heavier cycles and breakthrough bleeding because they don't have cycles. But other than that, it's all pretty much the same. The breast
Interesting.
cancers increase, prostate cancer effects, prostate issues. It really comes from this estrogen.
Um,
Estrogen dominance can be a really big problem for men and women. So, what are things that we can do to prevent the aromatase enzyme from upstimulating in our chronic inflammatory biotoxin illness patients? I love the natural products. And there just was, I think in 2022, this amazing study on quercetin, resveratrol, and chrysin, right? They're aromatase inhibitors, right? And chrysin is from a flower. And they're polyphenols, and they actually show decreased depression from decreasing the inflammation from chronic neuroinflammation. So, on several levels, these antioxidants and polyphenols are so important to somebody who has biotoxin illness, right?
mhm.
Because number one, it's going to improve the aromatization and of their hormones, and not creating too much estrogen in the body, and it's also going to help with neuroinflammation. It was a really great analysis of all the literature that has been out. I love it. It's an excellent, if anybody wants it. Another thing that can help is, of course, the zinc that I spoke about, and then DIM and indole 3 carbinol. These are a natural compound that is in brassica plants. It's in cabbage, kale, all of those things. And it's just an easy way to prevent it. I very, very rarely ever need medication to help with this. Anastrozole is what's a lot of these rejuvenation clinics. They just throw heavy amounts of testosterone at some of these men, and then they just throw in anastrozole. Say, oh, here, take some anastrozole. But if you don't
Um,
overdose the patient on testosterone and you know what's going on, you won't get the aromatization. It won't happen.
right, right.
It's just when you overdose people. And a really natural aromatase inhibitor is progesterone, bioidentical progesterone at a low dose. Men
Oh,
also, it helps with sleep. It helps with the aromatization process. It helps with GABA, producing GABA in the system when taken orally. There really are, I know in the past we used to give progesterone transdermally, but the benefits of progesterone really aren't there transdermal.
oh, interesting.
Yeah, they really don't protect the uterus. The studies aren't there. And everything's about evidence, right? Evidence-based and risk versus benefit.
Right.
And that's how I kind of look at things when I treat my patients.
So
Um,
before we move on from that slide, Dr. Noble, do you mind going back? I want to make sure I'm understanding this, and maybe that our listeners are understanding. We want our testosterone to stay as testosterone, and not get turned into a form of estrogen that may not be helpful. That may be one of these kind of less healthy versions of estrogen. I think you said it was estriol, right?
estrone. Estrone
Estrone.
is
Okay.
healthy. Estrone,
So
yeah.
for our men, we want their testosterone to not go down this aromatase pathway and turn into estrone, at least not too much. We want that to stay in balance. And
Correct.
especially if they have CIRS and they have the low MSH, they're maybe vulnerable to this happening more, especially maybe if they're supplementing testosterone, they'd be vulnerable to this pathway.
Yes.
So, am I understanding that correctly? That for our
Yeah.
guys, this is really important, but for our women too, right? So,
Women too, because many women have come to me on testosterone and they start having all of these symptoms. I have to back down or take them off because they start getting, it's really, I mean, inner trembling and anxiety. And when you have too much,
Mm,
androgens, you're going to get anxious and you're going to get this like weird, I've seen it so many times and I've had to take my patients off of it. So we back off uh,
yeah.
until we've treated the root problem.
Right. So if we're going to supplement, do any kind of supplemental hormone replacement therapy with testosterone, we want to be at the right phase in our CIRS healing, and we
Mhm.
want it to be the right amount of hormone supplementation. And we want to be curious about adding in these aromatase inhibitors to make sure that things stay in the right balance.
Yes, and I'm going to get more into a
Okay.
better
All
to
right. Take us there.
to deal. Yeah, yeah. I'm
Okay.
going to talk a lot about that. Okay. All right. So cortisol, you cannot ignore this whole steroidogenic pathway without this cortisol, right? With chronic stress and constant fight or flight, we're going to get a dysregulation of the cortisol system. This is huge. Okay. With toxins and biotoxin illnesses in itself, we get a dysregulation of cortisol. And we're in a constant state of stress when we have biotoxin illness.
Yeah.
If we're trying to figure out how to get ourselves out of exposure, we're never going to get better. We're worried about our families being sick. We're worried about it and everything we have. So this chronic stress piece is really, really important to
Yeah.
be addressed in our biotoxic patients. Your pain is increased. You're more inflamed when you have cortisol imbalance. You're more susceptible to autoimmunity and, infection. You can't sleep. You've got all of these, things, and it's just hit after hit. And if you haven't noticed, many, many times patients like seem to be okay. And then all of a sudden they've got trauma and then their biotoxin illness kicks in. There
Hmm.
you go. There
Yeah.
goes that, crazy, wheel, right? And that's, because of this, the whole system just is all out of whack with biotoxin illness and
Yeah.
trauma and cortisol dysregulation just kicks it all into gear so many times. I've seen it
Absolutely. I see that
over.
too.
Yeah. So this is what a normal cortisol curve looks like. And I think it's really important to spend, a few minutes on this, okay? Because it's so important. When I test cortisols, I test through the saliva. Now you can test in Dr. Shoemaker's ways to test the ACTH and the cortisol. The ACTH is basically released from the brain in response to cortisol, right? Kind of works the same way. This gets dysregulated in this whole balance, the brain cortisol feedback system gets all dysregulated. But I like checking it in my patients through salivary, right? Because
Mhm.
you really can get a better understanding of what's happening. And it's supposed to be high in the morning because you're ready for your day. And then as your day is going on, it's supposed to decline. And that's what this curve is supposed to look like. You're not supposed to be in the red zone, right?
Yeah. And the salivary testing you do throughout the day so you can watch your curve rather
Yes.
than just one static mark on that curve that
Yeah.
may or may
Yes.
not be as
And
helpful.
that has
Yeah.
to be done first thing in the morning when you check the blood. And it
Right.
depends on how long that patient's been up. So if the patient's been up since
Yeah.
4 o'clock and they're doing a 7, 8 o'clock cortisol curve, it's gonna look skewed. So
Right.
I
Right.
prefer, unless we're, looking for, Addisons and Cushings, that's a whole nother lecture and too much for today. But early in an early cortisol fight or flight response, and you've been stressed for, early on in this whole process, all the cortisol start elevating. Your DHEA elevates. Remember, that's that precursor hormone. It elevates in response. So this cortisol and DHEA have to be kind of looked at together, right? So DH starts to rise. It starts to rise to be able to supply more cortisol even and all that because it does trickle back into the cortisol cascade, right? As you go on in this chronic fight or flight response, eventually, the cortisols go up and down. They're high and low, and so do the DHEA levels. So you'll see high, low, like you'll just see them all over the place. And then finally, the body's like, I can't do this anymore. There's no more cortisol. There's no more DHEA. Where we call it, you're just completely burnt out and you develop
Mhm.
more autoimmunity. Everything, just starts to go wacky, right?
So we
And
can't mount that normal response to a stress. We've kind of gone down into what we used to call maybe adrenal fatigue.
Exactly. And
Okay.
that's really like frying our brain. This
Yeah.
cortisol really fry our brain. We've already got neuroinflammation from biotoxin, right? And now we're adding all this cortisol stuff. So all of these groups that we have that are dealing with the stress response is key. That piece is so important. We cannot ignore the groups and these all amazing people that are doing all these meditative programs and dealing with that. And everybody has their little place in this whole process, right? Our whole, group and all the people that are trying to help people that are dealing with this.
Yeah.
So here you can see the early on where all the cortisols are rising up into the red. You can see how it's up and down, middle, it starts going all over the place. And then you can see how it just plummets later
Mm.
on. And I just think that when you look at things and you visualize, I'm a visual learner, if you haven't
Me
noticed.
too. I
So
love it. Love the graphic.
yeah, yeah. So cortisol dysregulation with chronic stress is going to make everything bad, everything worse. Your hormone imbalance is going to get worse. Your toxicity to your brain is worse. Your immune, everything dysregulates, right? I've kind of beat this to death over here, but I think it's so important, and that's why. So you can see again the changes in cortisol and the ACTH. Dr. Shoemaker talks about it. He puts in his schematic because it was that important, right? It's right there. So thyroid cannot be ignored either, because when you have a dysregulation of cortisol, the thyroid receptors don't work. Again, the same feedback mechanism. But what's really important with the thyroid is it's going to start producing thyroid in the wrong direction, right? It's going to start when you have thyroid hormone, it it regulates almost, so many of our systems in the body. So we can't ignore it in this process either,
Mhm.
right?
Yeah.
I'm not going to spend, because I could spend a whole hour and a half on
Right.
just,
This is a lecture a day, a week, all in and of itself, right?
right,
Yeah.
right. But what I really want to press home is a lot of doctors don't check the reverse T3.
Hmm.
And what can be happening is we produce T4, which is, what we produce, but it has to be broken down by a deiodinase enzyme to T3. Okay. T3 is our active hormone. That gives us our metabolism. That gives us, all of the good benefits of thyroid hormone, right? But we develop it goes to reverse T3. So we get an effective low T3 and a high reverse T3 that a
Hmm.
lot of endocrinologists aren't testing right now. It will become standard of care. And it rises in mitochondrial issues. And we know that CIRS deals with the mitochondria in every cell,
Right.
which is our energy cell and also affects the way our genes work, right? So this is super important. Stress is going to cause high reverse T3. Nutrient deficiencies are going to cause high reverse T. So you're going to see this in
Yeah.
thyroid illness. So this is what the main point I wanted to make, that patients should be aware of, to ask their doctors to check that.
Yeah.
And to
So
make sure.
huge.
Yeah, it's so huge. And I wish I could talk more about it, but we can't be here all day. Okay. So when I check my hormones, and this is a big topic of discussion that people get confused with, right?
Yeah.
Serum testing is the standard of care. It is the standard of care. And if you are not on hormones, it's the best way. But when you start using transdermal estrogens and transdermal things, the serum many times won't reflect it.
Uh,
That's when we start looking at urine metabolites. And the urine metabolites are going to show you all that business about the 2-hydroxy and the 4-hydroxy and the 16-hydroxy and all of that. And you can even see the cortisol curve while doing the urine, because they can do that 4 points during the day, just like
wow.
with saliva.
Yeah. It gives you so much more information.
Yeah, I don't really do saliva testing for hormones, cortisols and DHEA, yes, because it's just what I learned over the past 20 years is it's all over the place.
Yeah.
It's not a good I don't like it at all. So that's just me. When you are menstruating, the timing is really, really important of when you check these hormones.
Mm.
Day 21 of a 28-day cycle. That's when it should at least, that's when you need to do it, because that's when it's going to be reflective of the hormone balance, right? If you are, transdermal naive, like I said, you can do it in the serum. With men, morning levels, if you're less than 40, are accurate. If you test a male at, 4 o'clock in the afternoon, it's going to be low.
Mm,
9 times out of 10, it's going to be low. But when you're less than 40, that you have to grab it in the morning. And a lot of people are missing that, right? If you are less than 50, we can try to stimulate hormones through something called luteinizing hormone. So when you're testing for it, you really need to look at the FSH and LH also in men. And that was that feedback mechanism that I was talking about. The LH and FSH, come from the pituitary. It's all that feedback stuff. When
yeah.
people, you might hear sometimes when patients are already being treated with testosterone, they do check right after the testosterone dose. And then when the dose is about to be reinstituted to see the proper dosing. But usually I don't do peak and troughs unless I'm treating the patient with testosterone. Um, what is key is, again, you cannot just test hormones. If you don't know what the body is doing, you're going to run into a problem.
This is
So
so
test,
key.
yeah, biotoxin. You can't be hormone doctor and not understand biotoxin illness. You know what I mean? Like I was like totally missing it back in my day too. Like I'm
Wow.
guilty. You know what I mean? I'm
Yeah.
this
We
guilty. I
don't
didn't
know what
know.
we don't know
You
until it
don't
happens. Yep. Do the
exactly.
best we can. There are a lot of well-meaning clinicians out there who just don't know about this piece. And I hope they're listening today. This is
Yeah.
really enlightening. You're doing a fantastic job. I don't want to interrupt anymore. So tell us more about these toxins and how they impact our hormones.
Yeah. So when you're looking for biotoxin illness, kind of pay attention to things that you don't see in hormone imbalance. And kind of you can look at those things and say, okay, so this is actual biotoxin illness. You're not going to get visual contrast issues with a hormone imbalance. You don't get that with that. You really want to know, see if your patient has been being exposed to a biotoxin, take that history, know that. I think that's really important that patients are aware of if they have had moles, maybe I am dealing with this. Maybe this is what's
Yeah.
making it all worse. And looking at all of the blood markers, including the leptin, and, making sure that that's not elevated, because if it is, there you go. You're going to get more aromatization and more of this problem. I'm not going to talk too much about testing for biotoxin illness because I think there's going to be a lot of other practitioners that are going to be doing that. But I just put it up there because
Yeah.
it's so important to make sure you're ruling it out or in. Um, when I look for toxins per se, pesticides, endocrine disruptors and things like that, you can see individually does this patient have a genetic issue where they're going to accumulate toxins? What is their exposure of of toxins throughout their life? Do they have implants? I mean, how many chemicals are in implants? Like right there, they have a heavy toxin load that their
Mm.
body has to process. So, when you take all of these things together, it's a stacking effect, and the system eventually will go, oh God, what am I doing? You know what I mean? And then everything just dysregulates and we have all of our problems, right? And so knowing the genetic potential, that's what SNPs are. It's just the basic genetic potential. There's something off with the genes and you're not able to detox like everybody else. So these things are important and need to be considered, right? And then I already spoke about the cortisol and the thyroid. And thyroid is really just through serum. I mean, there's no better way to test it. So treating. If we've got biotoxin illness, are we just going to throw hormones at somebody? Absolutely not. You have to go and get rid of the toxins and biotoxins. You got to do the Shoemaker Protocol. It is really the only thing that has evidence behind it and that works. Believe me, I learned from experience. I tried all these integrative therapies that we learned in integrative medicine, and my board certification and all of that for integrative and holistic medicine, and I didn't get better until I learned under Dr. Shoemaker, until I followed him, and finally my brain started working again after I
Yeah.
was exposed to biotoxin illness. It's the only thing that works. It really is the only thing. Believe me, I tried for 2.5 years and before I really figured this whole system out, and luckily got blessed with learning from him. And then the diet that, see how the detoxification efficiency is in your patient. What is their toxic load, etc. And then consider hormone replacement. So if we're
Okay.
right, then we're going to consider hormone replacement and you're going to consider it. I want everyone to understand that it's not scary. It's fine. The WHI study was a women health initiative study in 2002 that took everybody off their hormones. All these women were freaking out. All these women were taken off their hormones. But what we have to understand is that study was flawed. And
Mm-hmm.
none of
Right.
those, it was completely flawed. It was on synthetic horse urine estrogen. We call it equine estrogen. And it was on conjugated progestins. I mean, it was on, progestins and not bioidentical progesterone,
Right.
right? So we have the newest study, which is the, Menopausal Society study in 2022 that says the benefits outweigh the risks, and everything is risk versus benefit, right?
Wow.
You
Yeah.
want to initiate it within the first 3 years, and we know that it's helpful for at least 10 years. Doesn't mean it's not helpful or hurtful after 10 years. We just don't have the data yet. Okay.
Right. Right.
Bioidentical means not that it comes, completely natural. It's made naturally, but it is made. It is, synthetically made from a natural substance, and it's exactly like the chemical structure of your own estrogen and progesterone, right? Progestins, we don't even know where that goes. We can't even find it in the body. It is not even like our chemical
Wow.
structure, right?
Wow.
Yeah. So transdermal estrogen through a patch is FDA approved. Unfortunately, compounding pharmacies, we have yet to, they have, some debate about that whole thing. I love transdermal estrogens. I do give estriol along with the estradiol because estriol is effective as well. And I always give my progesterone orally because the benefits are not transdermal. Back when we started 20 years ago, we were giving progesterone transdermally. You do not get the benefits that you should get.
Interesting. That's great to
Right.
know.
And unfortunately, the progesterone that you can get at CVS and Walgreens and all regular pharmacies, it's made with peanut oil and it starts with 100 milligrams. And, when you get somebody younger who has, a premenstrual dysmorphic disorder or severe PMS because they're imbalanced and stuff, 100 milligrams is going to put them on the floor. Right. So
Mm,
we really need different dosages, and we need it to be long acting. It works better long acting. And
right.
progesterone from the regular pharmacy is immediate release. So it doesn't work as well. What's really important is the ratio of progesterone to estrogen. That's what you're looking at, not just one value. And then I'm really going to focus on the DHEA and pregnenolone versus just treating someone with testosterone. Okay. So the DHEA and pregnenolone, um, we're going to talk about further. They're the precursors to all of this. And sometimes that's a little bit safer. And I'll get more into that after talking about hormone replacement in men. Same thing in men. Testosterone can be given by an injection, a pellet, or transdermal. I do not like pellets. That's just me. I mean, you've got 40-year-old guys that are being put in with pellets. They're put into the subcutaneous tissue of the glutes, and you have to replace them every 3 to 4 months. So at a minimum, you're getting 3 pellets, and in 10 years, you've got 120 pellets. Like, yeah, that's 120 procedures. I mean, it just that should not be first line therapy, in my opinion.
Right.
But
Seems
that's
kind
just
of
my opinion.
invasive. Yeah.
I have a lot of great colleagues that love pellets. They find it convenient and
Mm,
whatever. But that's not my first line, but
okay.
these are the ways we do it. If you are fertile age, it's much better to kind of work with that luteinizing hormone and feedback mechanism to tell your own body to produce testosterone so you don't
Mm,
shut off your fertility.
wow.
So if you want to have kids, I do never suggest taking exogenous testosterone, even in the form of transdermal, which is the, very, the safest way. But injections are great, but they're fine. Again, I spoke about the progesterone, pregnenolone, DHS, spoke about all that. Again, there was 2 studies, the Vegan and Finkel studies, that just like with women, scared everyone on testosterone,
Mm,
right? Testosterone balance is super important in men. I mean, there's many benefits, right? That scared everyone, said the cardiovascular stroke risk, blah, blah, blah. Again, that was 2 studies out of 200 that say it's beneficial. And we just had a great study that just came out called the Transverse study, that showed that it shows actually no risk in cardiovascular protection. So we do not need to be afraid of that. I just wanted to point out where DHA and pregnenolone lie on the schematic that I love so much in the steroidogenic pathway. You can see they're precursors to everything, and they are a safer way of androgen replacement. I love DHEA because remember, it gives immune support. There's so many benefits to DHEA in an inflammatory process and then even an autoimmune process. So it's going to help with the cortisol dysregulation. It's going to help on so many levels, but it has to be tested. We
Yeah.
can't go because remember, it goes really high at the beginning. So you
Right.
don't want to be pushing DHEA when you've
Yeah.
already got DHEA of, 600 or something, right?
Timing
And
is everything. Yeah.
so in men, about 250 to 350 is about normal. In that range is the optimal range. In women, it's 150. I don't ever want them going over 250. 150 is about where I
Okay.
like to lie. When autoimmunity has set in, you will see that the DHA is like 10,
Oh,
right?
interesting.
Right.
Okay.
But what's important is DHEA can also convert to testosterone and estrogen. So if you start throwing DHEA without testing, again, you're going to run into the same issues, right? It
Mhm.
happens really fast in the women, especially if their liver's plugged up and the detoxifications aren't working, right? Those are the patients I go all the way to pregnenolone if we need some benefits of hormone replacement. And pregnenolone has so many benefits, right? You can see
Okay.
back to the DHEA because it's the best way to treat androgen imbalance in a CIRS patient. Because otherwise you're going to make somebody worse instead of better, right? And look, it lowers triglycerides. What does cholestyramine do? It can affect the triglycerides. DHA can help with that, right? It helps with the brain and the immune system, with everything, right? Decreasing the allergic and chemical sensitivities. Like it's really great. I love DHEA in my CIRS patients, right? But if you can't, and you know that they're fast converters, you know that they have a huge toxic load, they're big drinkers, whatever, they love their wine. Um, Pregnenolone might be a better option because it will also support the brain. It will also support pain and inflammation and all of this stress resilience and all of those things. So when we're talking about dosaging, I talked to you a little bit about it. High doses in women will run people into trouble. I've seen some crazy things. 5 milligrams can actually, if you have a liver plug up, 5 milligrams is gonna cause a problem. And I've seen it.
I've
So
experienced that.
I have exactly. Next thing you know, they're like got acne and their hair's falling out on 5 milligrams of DHA because they're converting all the way to DHT, right?
Yeah. Wrong timing. Yeah.
Wrong timing. But exactly, you're getting it. So sometimes 25 milligrams in a woman is needed, but it's rare. And those are the autoimmune patients. They're already in autoimmune state. Their cortisols have already plummeted. And those are the women that need that kind of a dose. But it's not a common occurrence. Men, you could go higher. I max out at 100 milligrams. I've heard some crazy dosages. You don't need them. You really don't. When it comes to pregnenolone, 10 milligrams, titrating up slowly to a level of 100 is about what I use. So, that might be a little bit too much for our community, but what's important to know is if it is too much, you're going to know right away because you're going to get irritable and anxious and
Mm.
not feel well. And you'll know right away. Okay.
Interesting. Okay, good.
So pay attention to irritability and anxiety. All right. So what are the take home and what is the most important is individualization. Everybody's body is different. So Shoemaker Protocol, detoxification, what's going on with their cortisols? Are they sleeping? What is their stress response? Are they getting, doing meditation and doing yoga and doing
Mhm.
things that please their soul and things like that? What is their nutrition? What is their diet? Do we have other factors that are going to make them aromatized into estrogens? So what are we doing, right? So patient takeaway, you got to look at the root cause of the imbalance. It's not always just menopause or andropause. We do have something called andropause men, right? So you don't need to be afraid of cancer or cardiovascular risks. There are proven benefits when done correctly, and there are
Mhm.
studies to support that. All right. In the setting of CIRS, got to pay attention to those estrogens and cortisols, and you must address the gut for detoxification, nutrition, and all of these things when you're considering hormone replacement. So I hope this was helpful.
So, Anjali, I think you have some references for us that I think would be helpful to have on video if you're willing to share your slides with these different references.
Yeah, so here are some references. I mean, everything has been cited. It's really important to make sure that, the physicians that are treating you are taking things that are actually evidence-based and are in the literature to be valued. Otherwise, people can say anything. So here are some references. You can see the Finkel study and the vegan study that I spoke about that was not so
Mhm.
good. The two 2017 NAM's statement is there. The 2022 one will also be there. There's a reference about the progesterone versus the synthetic progestins that we talked about, and the safety in breast cancer when properly, balanced. And, I got a lot of good information from the 2023 Raquel chapter for integrative medicine. They have a really great review in there.
Wow, it was
A lot.
incredibly helpful. Dr. Noble, I know I'm going to have to go back and listen to all of this and go through it slowly to digest and probably take notes. Others might feel the same. I'm so glad that we have this recording here in the summit. And for those who want to come back, you can purchase access to this recording so you can listen to it again and again. There is so much here. Did I interrupt you before your closing, Dr. Noble? I'm just so excited about everything that you've shared with us.
No, I'm just really excited to get the information out there because I really
Wow.
just see so many crazy things being done to people. And it really weighs heavy on my heart to see that. And then, it takes a lot of work to undo the damage. But we do it and we get there.
Yeah. Well,
Yeah.
go ahead and stop sharing your screen so I can see you more. I'd love to kind of process a little bit of this, make sure we're all understanding these takeaways before we go back and listen to it again and again. But so I guess my takeaway, and tell me if I have this correctly, or one of my takeaways is that there can be a variety of reasons for hormone imbalances. And if we just dive in and try to treat directly the hormone imbalance without looking for the root cause, we're not looking at the system of the whole as a whole, and we're probably not going to get the results that we need. So we really need to work with somebody who understands systems biology, and
Mhm.
ideally somebody who understands biotoxin illness, because this can be a huge contributing factor to hormone dysregulation. And if we're
Correct.
just dealing with the hormones and we're not looking at things like the gut and toxins and biotoxins and the CIRS, the pathway, we could be missing so much and maybe even doing more harm than good, or just beating our head against the wall, wondering, why is my thyroid not fixing itself? Why am I still in estrogen dominance? Or why do I still have these menopause symptoms? Right there, menopause has so many similar symptoms, like you showed us. If we have a
Yeah.
decrease in estrogen, the symptoms are so similar to CIRS. And you highlighted those at the beginning, and I'm going to go back to those. I think as more and more clinicians are becoming savvy about menopause treatment, which is good,
Yeah.
they are treating women for this, which is good, but maybe not fully understanding the contributing factors that you just brought in, and
Yeah.
maybe supplementing without the full appreciation of the potential impact of living in a water damaged home. Uh,
Correct.
and right. And so, for treating menopause without looking at toxins, including water damage building exposures, breast implants, other environmental toxicants, maybe we're not getting the results we need. So, if that's you, you're treating menopause and you're not feeling any better, look for a clinician who understands these other aspects of gut health, toxin exposures, biotoxin illness or CIRS, and you might get much better results. And then
Yeah.
same thing for our men, who are maybe going through andropause, they're getting low testosterone, they want to just go and supplement. If they're living in a water damaged building and they have leptin resistance and low MSH, that may go down that aromatase pathway, and that's not going to help them feel better. Right? So the
Correct.
timing is everything. Putting it all together, you showed us how to test for all these different hormones the right way and at the right time so that we can figure out, okay, this comes first, then this, then this, then this. And all the while, gut health, stress management, this is going to help everything take better if we're taking care of our inner terrain, right?
Yes, I love it. Yep, you
All
got it.
right.
You definitely picked
There's,
it up.
well, I was trying hard. I think I need to go take a nap now.
I know it's a lot, but
It
you
was
could
a lot.
see I tried to summarize as best as I
Yeah.
could for people to get the big picture.
Yeah. Yeah. There's so much here, whether you have estrogen dominance, menopause, perimenopause, low T, thyroid issues. Listen to this again. There's so much here from Dr. Noble. Dr. Noble, if people are really resonating with what you're talking about, how can folks find a clinician like you, or can they work with you? Are you taking new patients? But where can they look to find a clinician who really understands all of these different pieces that are so important to hormone care?
Well, I definitely am taking new patients. I do have,
Wait list.
yeah, a little bit. Yeah. You can look at the IFM website, the A4M website. You can look at ACAM, all of these type places. I think the A4M does a really good job at training
Yeah.
their patients. They really just did an update. It was fantastic. I mean, everything was on cue. I didn't see any, sometimes some of these conferences have paid speakers that say crazy things that should just be on TikTok.
So A4M, that's the letter A, the number four, the letter M, American Academy for Anti-Aging Medicine. Is that what that stands for?
They are really, really
Okay.
good. When it comes to the hormone
Yeah.
balance and everything, IFM will help put the other, pictures together also. I mean, that's some people like
Mhm.
IFM. They have
The Institute for Functional Medicine. Yep.
yeah, and I do hope that someday I can, get to the point where I can start training, but I'm training other doctors to, really understand this. But right now my heart resonates with the patients who are suffering. Um,
Um,
and
yeah.
trying to get them better because there's just a lot of misuse and misinformation out there. So hopefully,
Yeah.
you know, I got the word out.
You did. And I think of so many of the women in my client community. There are many who are around my age, perimenopausal or postmenopausal women who've gone through the Shoemaker protocol, and they're wondering why do I still have my fatigue and my brain fog and my insomnia? Well, maybe there's another cause of these things that the Shoemaker protocol has helped to reduce the one of the main contributing factors, the biotoxin illness and all of the dysregulations that come with that. But you may now need to see a hormone specialist about bioidentical hormone replacement therapy to help resolve some of those remaining symptoms that are still hanging on and may not be CIRS anymore. Would that be
Right.
fair to say?
It is. And what I have found in my patients, when you treat hormones, treat all these other things without treating the biotoxin illness, it will take you 10 times as long to feel
Yeah.
better. If
Yeah.
you have biotoxin illness, you got to treat that
Got to
first.
start there.
Then you can do toxins, then
Yeah.
you can do hormones. Like toxins and gut health are all one in my opinion. But you can't have biotoxin illness and not start with that. Because I've had
Right.
people that explanted because they thought they were, they wanted to explant before they got rid of the mold and they wanted to decrease this and then that. They took much longer
Mhm.
time to get better than my patients who actually did the protocol and then explanted and then they got it better right away,
Right,
right?
right.
But without the protocol and
Mhm.
without, calming down that immune system, it's just a big disarray.
Right,
It was
right.
all in disarray. You
Yeah,
have to start with the biotoxin and the cortisols and things like that first,
right.
because it's just you're going to just get worse, and people are not understanding why they're worse. And
Yeah.
it does take a lot to be able, in a lot of years, to be able to just put it all together. Like I said, I was missing it, but I've been doing this now 20 years, so now I'm able to put it all together. But I definitely missed it. I can't tell. I mean, I'm sure 10 years ago I was like, miss patients that had this, you know?
Yeah.
So I mean, it makes, but I know now.
Well, we all did the best we could until we know more. And I'm sure there's still more to come that will help us serve clients and patients even better in the future.
Yes.
But you're doing an amazing job. And thank you for the work that you're doing in your clinic and our surviving mold professional community and here at the CIRS Summit and with your patients. Thank you for your time and expertise and for sharing that with us today. We're so very grateful. This is Dr. Anjali Noble at the Noble Center for Health and Healing in Boca Raton, Florida. You can check out her speaker page if you want to learn more about her. And I'll see you at the next talk. Thank you so much, Dr.
You're
Dr.
welcome.
Noble.
All
Bye
right.
bye.
Bye. Bye. Bye.